What we see here are some serious life-threatening arrhythmias, ventricular tachycardia, and fibrillation. What we saw on the previous slide was, sinus tachycardia, again, from the SA node, if you want to go back to that. So, again, tachycardia here originating from the SA node. These are the ventricles, again, going rogue and rebelling. So ventricular tachycardia. This is when a person has multiple PVCs. You can see that looks very, very abnormal. Ventricular tachycardia. That is when you take CPR and the AED, the defibrillator, is looking at analyzing the rhythm. This is what it's looking for. So ventricular tachycardia, or VTAC. So if the person is in this rhythm, the AED is able to shock them back to a normal rhythm oftentimes. So that is shockable. The person is going to be unconscious. Someone who is, having this, you can see the heart is not able to pump blood. The person is going to be unconscious. And so the first one, that is VTAC, ventricular tachycardia, again, very serious, life-threatening. If left untreated, then the ventricles will just go into ventricular fibrillation, where they're just quivering. And so they are, and eventually the heart will stop. The AED will not be helpful here. The defibrillator only works when you're in VTAC and not VFib. So it would analyze the rhythm, tell you shock is not advised, and you would need to continue CPR until the person gets transported to the hospital or EMS arrives. So they're very different, but VTAC is very, very serious. People who are having heart attacks, maybe having VTAC, and post-heart attack. So, but especially during an acute heart attack, they may be having ventricular tachycardia. Here are some other serious arrhythmias. Atrial flutter. And if you look at this top strip here, again, it looks kind of abnormal. You don't have your PQRST. So the P waves, some people call them sawtooth. Some people call them picket fences, that they look kind of like a picket fence. So, you still are going to see a little bit of your QRS, but you've got this atrial flutter. People often will need to have medication, or they may need to have a procedure that shocks the heart back to normal rhythm with that. Atrial fibrillation, again, can be very serious. Often accompanies, underlying heart disease. And that is when you just see the atria are just quivering. So that can be very serious, and people who have atrial fibrillation are at risk of stroke, because blood clots tend to form when the atria are quivering like that, and the heart is just not able to effectively contract. So it can be a very dangerous situation. You've probably seen something on the commercials on TV for drugs for atrial fibrillation, or for people who have blood clots due to atrial fibrillation. So both of these can be very serious. Again, flutter has the sawtooth or picket fence kind of P waves, and then the fibrillation is just the quivering of the atria. But do look at the links on Blackboard to get more practice with some of these. And then AV block, this one is not an easy one to see. I would not give you this on the test. I find it unlikely they would put it on the certification, but you have a delay in your PR interval. So you can see the P wave is a little bit further out from the QRS complex. So once again, it's because the delay through contraction through the AV junction, and certain drugs, or if someone has heart disease. So be sure that you know the basic functions, the conduction pathway through the heart, the history of the ECG. That could be an excellent test question. Part 2. And what does the ECG do? and then being able to recognize some of those basic rhythms. They will be on the test. And then you can answer the question for yourself.